Hey there, everyone. Welcome back to another episode of the Growth Room podcast, where we dive into all the facets of healthcare with experts who are leading the industry. Please join me in welcoming David Harris, the Chief Operating Officer at Spear Physical Therapy. Thank you so much, and we appreciate you for joining us, David. Can you please tell us about yourself and what you do at your organization?
Sure. Thanks for having me again, Sal. I really appreciate it. But I come with a background in the physical therapy industry, just over 25 years. I've spent a majority of the last 15 years in operations leadership, but started my career as a clinician and worked through multiple positions in the clinic as well as in the leadership side. Today's my role today is in line with the daily operations of just over 50 clinics in the New York City area. And I oversee not only daily operations, but the processes behind all of the administrative functions from talent acquisitions, human resources, IT, innovation, things of that nature.
Super interesting. Can you tell us what your workflow is like? What is it like to be David for a day?
And I would say ever changing. So, in reality, every day is working with each department, making sure that workflows are going in the proper direction. But also just working with different teams and throughout the organization to make sure that we have, not only the latest and greatest in talent, but also that we have the latest and greatest in efficiencies. And as you know, healthcare that's something that changes on a very frequent basis. So my job is just to make sure that we are doing things not only the right way, but to make sure that we have the right people in the right place, the right technologies in the right place.
That's great. So, how critical is technology in your day-to-day processes? What processes, tools, or tech do you rely on to perform optimally?
Yeah, I think it starts out with, I mean, everything we do from the back end technologies of your phone systems, your internet security systems, all of those things to your EMR system, the daily functions that you run there. And then also some of we look at the revenue cycle side of the business, utilize technologies there as well. Uh, there's probably dozens of different technologies that we use throughout the organization, and we're always looking to kind of scale that up. And in reality, just utilize the right technology that can remove barriers from frontline clinic to back end collections.
Yeah, definitely. Technology is very a very evolving thing. So, what about the team you lead? What kind of challenges are they facing, and what type of technical solutions do you think would improve your team's performance?
Yeah, I think if you're talking of today's technologies, a couple of different things I would say that would help us, and we see this coming into the profession now. One would be starting with our authorization processes, verification processes, utilizing different tools, different bots, and AI technologies to help us with verifications. Utilizing some of the AI technologies in line with documentation. That's pretty new and not really well tested yet. But there are a couple of companies out there that we're talking to that they bring a tool to us, and as that gets refined, and it's actually made a lot of progress even within the last 5 to 6 months. That to me will remove a significant barrier. The biggest thing that we hear complaints about from the clinician side of things is how do I document? How do I actually decrease documentation time? I'll see as many patients as you want me to see, but I just don't want to do this, 45 minutes to an hour of documentation every day after I see patients or coming in early and doing that. I think the other thing that we probably don't utilize as much as we need to within the profession is technologies with our actual programming. From falls risk to athletic performance to different assessments. There are technologies out there today, and that have been brought together in some, some capacity, that we're using some of and not really utilizing others. So I think it's really just keeping ourselves in the forefront through networking, through working with other practices, working throughout the profession to really see what can we take from that and what fits our particular population. Because I mean, every city you go into, you're going to have a different demographic. You're going to have, one might have a high sports population, or a demographic that's running from 20 to 30. You go 2 miles up the road and you've got, 55 to 75. So determining what technologies can we bring into the patient experience that will actually work with both of those groups, because it's pretty common that we see, especially in a practice this size, we're going to see a variety.
Yeah, super, super interesting. It, for the past 20 years or so, we did have a transformation. Well, healthcare has had a transformation where everything started to go from paperwork to digital. And a lot of, it was kind of, coined as the digital transformation. But the last 4 years there has been some interesting work um, that has been done on the technology side of things, where we're really starting to see the full effect from an from an observant standpoint of AI, right? So there definitely has been a lot of people in the healthcare industry who has acknowledged AI and can somewhat understand the benefits of it, but adopting it and learning how to correctly utilize it is going to be a journey. So what are your thoughts around how this AI journey is going to pan out for your org and for the healthcare industry at large?
Sorry, Sal, I'm losing you here.
How do you think this AI journey is going to pan out for your org and the rest of the industry at the healthcare industry at large?
Well, I mean, I think we're kind of in the infancy of it for this industry. I mean, we're not really
Right.
accustomed to it. We haven't utilized it in the past. So I think it's going to be, as you said, it's going to be a journey. We're going to have to really engage with the experts. And these experts are coming on really quickly. Right? You've got people that have likely been working on this for a number of years, and it's just now coming to market. So, I mean, I think our biggest obstacle is going to be figuring out, is this technology secure? Can we keep patient information in the right place? Because that's probably, in my mind, some of the biggest concern is letting patient information get out. So we have to just make sure that it is something that we can utilize in a safe manner. The other side is really tying platforms that we have to utilize. So such as an EMR, making sure that you have an integration. So for instance, if you're doing documentation, you have to have an integration phase with that documentation system. So it's not just utilizing the AI technology, it's making sure that it works well with the other technologies that you utilize. And the other side, he'd be looking at, if I'm looking at a verification side of things or authorization side of things, you might have 100 insurance companies that you're contracted with. Understanding and defining the nuances in with AI, which typically works on patterns. As I know, I mean, they pick up trends and patterns, whether it be a website or whether it be, verbalized, and making sure that you can have the technology work in a way that you don't end up, doing 1,000 verifications and 500 of them have to go back, redo them by with a person, because, this web page or this call center had a different set of trends that this AI may not recognize. So I think overall it's going to be an interesting journey, but it is a journey that we need to embrace. I mean, there's such a benefit to utilizing technology to enhance the plan of care for a patient and making that experience something greater for them. And then on the flip side, making it an experience for our clinicians to and our back office, front office, making it an experience for them so we can actually improve their overall job satisfaction.
So you're saying, we should embrace this AI journey, right?
Sorry, so you're cutting out quite a bit.
So you're saying we should embrace this AI journey, right? But the question
Oh,
is,
absolutely.
but the question is, what what tools do I have to go on this journey with, right? For everyone, because kind of everybody's gonna have to be making this transition at some point, right? But what do I know right now? Do you feel like there is some upskilling that is specific around how to use AI or some level of data literacy education that has to happen for everyone across the board in order to correctly utilize this? Because like you said, it's a journey, right? So people gotta know how to embark themselves on this journey. Do you feel like that there's a big gap where a lot of this upskilling needs to happen?
Absolutely. I mean, again, I've been in the industry 25 years, and this has really just taken off in the last, let's just say 12 to 18 months, and really taken off in the last 6 to 8 months. So I think there's a lot of education that needs to happen for those in the profession to understand. Not only, I mean, a basic understanding of the technology is one thing, but understanding how you can utilize the technology in different parts of the business. I do believe we're going to have as a part of this journey, like anything else, we have to start with education. I'll just take you back to an earlier comment. You know, when I came into the profession, everything was done on paper, right? We did everything on paper. Weren't really many electronic medical record systems out there. You had a few archaic ones, but in reality, most practices have phased over to technology in the last, say 15 years. There was a journey there as well. Understanding the technology, understanding, the bells and whistles of the technology then, as well as those that are coming now. So I think that would be an optimal setup is, if the technology's there's got to be a set of people that are experts, right? They develop the technology, they know how to use it, they know the insides and outs. Being able to actually articulate that to a healthcare provider, help them to understand where is the benefit, where's the advantage of, technology X, Y, or Z, and how does that actually help, quite honestly, remove barriers. Um, and improve, bottom line, you've got to be able to improve metrics in some way to justify the cost. So I think that's the other part, not only educating on what the benefit to the provider as well as the patient might be, but also providing the input of how's this going to save you time, therefore save you money.
Yeah, that's super interesting. Do you think there's a change management component to this where people at the organization need to be, say for example, there's a physician who doesn't want to try new things because the things that have been working for them for such a long time haven't broken. Do you feel like there's a change management issue here, some friction with not wanting to embrace the AI journey or wanting to obviously taking it slowly is fine, but just not wanting to embrace it? Like what do you do with that?
Well, I mean, I think you're going to have a little bit of both sides there.
Yeah.
I would just say for our practice in general, No, I mean we are very open to embracing any kind of technology. I think we are, we just transitioned into a new EMR late last year and utilized a heavy amount of technology to, do the transition of data and all of that stuff from one system to the other. So we're very much in line with embracing that. I think that might go along with the New York vibe, accepting things a little quicker. Uh, but I also think you're going to have a large part of the profession, including us, that hey, we have done this way for a number of years. It has been successful. Why would you change it? So I think there's going to have to be a value proposition brought out. Even if you're willing to accept technology or and jump in, there's going to have to be a value proposition by the vendor to say this is what makes our product superior, and this is going to help you scale or take your business to the next level.
So, do you feel overwhelmed by all the tools that you're using, or do you feel like you need more technology?
I mean, I think we need more technology, and I would just tell you that that is something that we focus in on really on a daily basis. You have specific team members that work directly on just looking for different types of technologies, and so I think it's technology can be overwhelming if you don't take the time to understand it. But I believe you have to put people in places on your team that truly do understand it and can come to you with a different perspective and educate you. Because as a healthcare provider, I'm in the business of people, and I need people on my team that are in the business of technology that will help people, whether that be our team or our customer.
Yeah, super interesting. Okay, so this, as people get more and more educated about this stuff, do you feel like there will be new job roles for this during this AI journey? Will there be somebody who is an administrator of AI at every healthcare organization? How do you see the and the deprecating of job roles of old ones that you no longer might need? How do you see this shift in job roles happening as the AI journey plays out?
I mean, I think you got to have both. I mean, we're a people business, so we will always have people facing people. But I do think that the AI technology, as well as other technologies, will streamline our processes. And you may today have a position that has two, three, four people in it. You utilize a certain technology, you may not have to have all of those positions. So then you have the opportunity not only to take someone that's experienced in your organization and grow, add locations, add different things to your, I guess, your toolbox, if you will, but you can also work on having a more efficient flow. For instance, in an office, if I have, three people working at a front desk, and there are technologies out there that will not only make it easier on the patient experience, but also easier on the front desk experience. You may not need as many people filling that. So you can potentially reformat your space and add more treatment space versus administrative space. A couple of different areas that I will think about there. But I think for us, it's going to have to be, we're going to have to figure out how do you blend the people side of this into the technology side. And in reality, if it clears a barrier, then it has interest. If it's just a shiny bell and whistle, it doesn't have a ton of interest because we have to be very conservative with our spend to make sure that we can keep the doors open.
Yeah, what about, as AI gets deployed and people start using it, um, obviously this is not something that somebody could install in their organization and let loose, right?
Correct.
There has to be some level of control over it. the AI, how do you think the control of the AI should be designated? Do you think there should be one person that controls the AI, sets the parameters, and controls the temperature of it? Or do you think it should be everybody who's connected to the AI? They should be able to control the parameters themselves.
I would say there would have to be certain control factors in there. I don't necessarily think that you put anything in one person's hands necessarily. If you think about, if this guy or girl wins the lottery and they're gone tomorrow, well, then you're stuck, right? Because you only have one person responsible. I think you can have leads, but I think it would be a very nice setup to have, each department to have someone that has a control function and understands the technology versus having it in one person's hands. I think there are other sides of it that, for instance, if it's tied back to documentation, well, then the user, yes, they have control, and that needs to be variable. But as far as the organization itself, yes, you might have one or two experts, but I think you have to have some knowledge base throughout the departments to understand how to utilize it best in that particular department.
Yeah, I totally agree. Um, do you feel like AI is going to just impact one specific department at the healthcare org, or at a hospital, or do you think it's gonna everybody needs to be uh, touching this stuff and utilizing it somehow?
Well, I'll start with the disclaimer of my very limited knowledge and experience of AI, which I would say would fit a majority of our population. I guess in just my initial thoughts would be that it can be utilized in all aspects of the business, from patient care to documentation to insurance verification, authorization, even possibly to helping you to streamline and make, there's a lot of technologies out there now with AI that you can, make your videos, you just, speak into, a microphone, so to speak, and it creates a video for HIPAA compliance or, your harassment training for the year. So I think it can be used in so many pieces of the business. Uh, the thing that I would say, and it goes back to earlier part of the conversation, we only know what we know. And until education comes out on each of these pieces or we're introduced with the technologies, we just don't know.
Yeah. I guess we'll have to, keep slowly learning on this stuff and try to stay ahead the best we can. Wow, what an adventure. My concluding thoughts are that AI has a big role to play in healthcare this year. Implementing AI really well and learning about it will provide the most impact out of anything else. It was such a pleasure having you on the show, David. I'm looking forward to having you on for future episodes.
Absolutely. Thank you, sir. I appreciate the time.